In this morning's Health Watch, the flesh-eating bacteria. Serious infections of MRSA or MRSA affect 94,000 people in this country each year and are linked to 19,000 deaths. In 2005, Sandy Wilson was 7.5 months pregnant when she got the infection. And after an emergency C-section, her son wasn't affected. He's fine, a happy 5-year-old today. But the disease horribly ravaged her body, hospitalizing her for nearly 2.5 years. Sandy joins us now exclusively this morning, along with our Dr. Jennifer Ashton. Good to have both of you here. Sandy, I can't imagine. You have this baby. You're also a pediatric nurse, so you know so much about what's going on. Your son is born healthy. After a month, you finally get to go home. You're there for 2 days, and then you end up back in the hospital. Talk us through what happened.
Well, I had gone home for those 2 days, and while I was in the hospital, I was diagnosed with a blood disorder, so I had to have some treatments done for that, as well as see my doctor. And I had gotten home from a doctor's visit that morning, went to go lay down, had to get up for the nurse that was coming in, and I noticed a huge amount of fluid that was coming from my C-section wound, and I knew that that wasn't right. And the nurse who was there and my family that were there were sure that something was completely wrong. My blood pressure was very low, and they took me back to the hospital, where they rushed me into the operating room, opened me up, and realized that I was having this problem with the
And it was eating away at your organs,
Mm-hmm.
upper organs. It ended up eating away at your flesh. So you spent nearly 2.5 years in the hospital. What's that time like for you, especially as a new mother? You're worrying about your child, and yet here you are wondering if you're going to make it home to him.
Well, I was very confused in the beginning after that because of the surgeries. I had surgeries for the month or two after that, once a day, sometimes twice a day, going down to about 2 times or every other day.
Wow.
So I was very confused from the anesthesia, and I didn't understand why I couldn't see him. So I was accusing everybody of keeping him away from me, and I also thought that he had died and I had done something wrong. So I was being punished.
Right, none of which was true, of course.
Exactly.
Did they give you any indication, because just the fact that your body can survive that many surgeries is incredible, but did they give you any indication of how you actually caught this infection or this bacteria?
They really don't know. From the treatments that I was getting for the blood disorder, I had roughly around 750 donors during that time, as well as I had a central line. I had an open C-section wound at the time. Also, I'm a pediatric emergency room nurse, so I could have been colonized with that prior to delivery.
You're around stuff all the time. Jen, when you hear this story, I mean, it's amazing and wonderful, frankly, that you're here this morning and doing so well.
Yeah, this is really our worst nightmare in the medical profession, and I've seen this with a patient, and we're talking here about a bacteria that is highly resistant to what we call our big gun antibiotics. So we always have staph bacteria all over us. About 1% of the population is what we say colonized with MRSA or MRSA, usually, believe it or not, in our nasal passages, and all it takes is either a sick person in the hospital or a person on the street with an open wound, and we'll talk about some of the risk factors in a second, but that bacteria gets into the body, can become rampant, and gives you a condition called necrotizing fasciitis, which is what Sandy has, where literally it starts killing the layer of tissue that holds your abdominal organs in place, and it is life-threatening. About 50%, 1 out of 2 patients with that condition, necrotizing fasciitis, can actually die from it.
Talk about sobering numbers. So what are some of the things that we look for to know whether or not you may have this?
Well, this is where MRSA lives. First of all, in crowded places, so daycare facilities, prisons, you can see a lot more of this resistant bacteria. Anywhere where there's close contact, so sports where there's skin-to-skin contact, wrestling, those kind of sports. Again, any compromise in your skin. So a cut, in Sandy's case, she had an open wound from her C-section and IV lines. Any compromise in your skin integrity. Contaminated items is another factor. Sporting equipment, things at health clubs. Razor blades, do not share those things, sanitize them. And lastly, of course, lack of cleanliness. In a hospital, we see a lot of this, but it's also seen a lot in the community.
And it can look like on your skin, it can just look like a spider bite or just little raised bumps.
It can, and the key, Erica, is that it's red, it's pink, it's inflamed, it's hot to the touch, and it spreads rapidly. And when you start to get a fever, low blood pressure, that's an indication that it's in fact systemic through your body. And Sandy was in shock when she got to the hospital.
And that's when you call your doctor. You got there in time. Of course, we know why wash our hands frequently is one of the most important things we can do.
Absolutely.
Sandy, though, 2.5 years later after all of that started, you're here, you're healthy. At one point, you had an open cavity in your abdomen.
I did.
Did you ever think you'd be to this point or be able to celebrate your son's birthday?
I didn't, actually. I know that when I first looked at it, it was very hard. And knowing what I had seen in the emergency room, I thought, you know, I can't live through that because you can't live without your abdomen. I mean, an arm, a leg, you know, your vision, you can live without those, but you can't live without your abdomen. So, and I could read it on people's faces. They tried really hard to be encouraging, but I could read it.
But you beat the odds, and you're here. Thanks so much for sharing your story with us. I know it can't be easy. We appreciate it. Sandy Wilson, Jen, thanks for being here with your expertise as always.